penile cancer is cancer of the penis.
Okay.
So basically, it usually affects the head of the penis, okay? And it is related, it can be related to sexually transmitted polyps, the warts. So males have warts as well. HPV, it's a viral.
So they would catch the warts virus first, and then that would develop
They
into...
could be, I never say that it is always sexually transmitted, because who am I to say that? So basically, warts that most of the times are sexually transmitted, and they are known by the abbreviation HPV, which is a virus. And not all HPV warts can become cancerous, but some do. They can change from a wart, which can be, treated, to something that can be, cancerous. And this wart keeps on growing, and again, there's the issue of embarrassment and the issue of having to face the fact that one can be suffering from an STD.
So again, then the main message is that as soon as there is anything which looks a little bit different, but warts, you can get warts on the shaft as well, right?
Definitely.
But they're not
cancer,
so worrying.
And even cancer, you can get it on the shaft, but mainly it's under the foreskin or on the foreskin, and it's not always related to STDs. It can be related to poor hygiene, and an elderly man that can be, one can understand that.
Yes, of course.
And also to foreskins which are not retractile. So sometimes the issue of the foreskin, okay? So we have sometimes two extremes. The tendency a few years ago was that when a boy was born, there was this, aura of having to
pull down the
skin. That should be a bit less encouraged, okay? But then that could cause later on, much later in life, if it is retractile, it is very difficult to clean. So ideally, the teaching point is to one should be careful of his own hygiene,
Yes.
And anything which is strange, to go to the doctor early, because penile cancer is extremely dangerous.
So to recap then very quickly, we have the three main male sexual cancers, which are one, the testicular cancer, which from 20 years onwards they should be doing a self-examination. The other one is the prostate, which you should go for checks to your doctor after the age of 50 because there aren't any signs. And the other one, which can affect you really at any age, which is penile cancer.
Usually the elderly.
So if you have any warts, to go and get them seen to, and not to be embarrassed and to
That's it.
leave
As
them
a
alone.
bracket, there are specialists who are better than urologists in STDs. And these are the GU doctors.
What are they called?
Genitourinary.
Okay.
Like the doctors of the GU clinic.
Okay.
So for suspected STDs, sexually transmitted diseases, one should go to a GU doctor. We operate on certain problems like penile cancer that can be an STD, but for sexually transmitted diseases, the best specialist is a GU specialist.
In the case of testicular cancer, for example, what does somebody face?
So basically, with testicular cancer, the surgery for it is the removal of the diseased testicle. So there is mainly it's a psychological issue, because cosmetically, when you see a man with one testicle, it is very difficult to realize that he has one testicle. First of all, the other testicle will grow and compensate for the loss. The other testicle will grow physically. No. The size of the other testicle, of the one left behind, will become bigger eventually.
Oh, the existing one will. Okay, right. Okay.
So that fills in the scrotum better. There are prostheses that one can put inside the scrotum to replace.
So the skin would be left there and filled with a.
That's it. The operation is a groin incision for testicular cancer, so it's an incision which is similar to a hernia repair.
Okay.
The operation itself is an intermediate operation, and
what do you mean by an intermediate operation?
So it's not a major operation, but
so you go in the morning and home in the evening?
Yes, it's usually a day case, or perhaps one night. The recovery is short, and the main complication is bruising.
Which
the immediate. But in the scrotum, you might get bruising, which is more considerable than in other areas because the scrotum will be an empty space then. So if there's a bleeder, it will fill. While if it's, let's say, in the hand, the bruise will be more limited. So bruising is something that might happen, unfortunately, after surgery. Psychologically, obviously, the man will be affected because it's a bit of an ego, you know, I mean, to have two testicles, and this is something that I...
But at least they can opt for having this prosthesis if they want to.
Yes, but it is better not to. It is better
and
not
allow
to.
nature to grow the other one instead.
Sexually, if the other, assuming
First of
that
all,
the
one
other
is harder,
testicle,
I suppose, than the other.
No, the texture is quite good. There are some issues with prosthesis. First of all, if the male is in a mature relationship, most will not opt for the prosthesis. Secondly, the other testicle will eventually grow to fill that space. Thirdly, the prosthesis will not give you an added sexual function. The other testicle, assuming that it's a good testicle, will give you the same libido, the same sexual function and fertility. We don't need to be fertile, you know, and we don't need to for the same sexual function. The issue with prosthesis is that sometimes, with time, it tends to form fibrosis around it. Fibrosis, which is scarring.
Yes.
And it can be retracted upward. So you will end up with something which is rather unnatural.
And would you have to have it removed?
No. But sometimes, at a later stage, you might have your doubts.
So better to let nature take its course then.
And I would
always
advise prosthesis at a later stage when the treatment, if there is any treatment to be done,
has been completed.
That's it.
Always. So, prostate cancer then, life after that?
The treatment of prostate cancer will definitely have an effect on the erectile function. Because anything to do with prostate, whether it's an enlarged prostate or prostate cancer, first of all, prostate grows and prostate cancer happens because of the hormones which affect the prostate. So if in the years gone by, the treatment for prostate cancer was castration, because the testosterone which is formed in the testes is the fuel to the prostate. So once you cut the fuel,
then the prostate stops functioning.
That's it, and it shrinks and the cancer shrinks. So any treatment which is aimed at the prostate, whether to keep it from growing or to control the cancer, unfortunately affects the testosterone and it affects the drive. So certain treatments can affect the drive, can affect the erection, and they can even cause some breast enlargement. So I sometimes joke that they may cause also some hair growth. But obviously, because it is the male hormone which causes these effects, you know, the heat, the sexual heat, the erection, and
so what can somebody do about that? What is the treatment or cure for that?
It depends the type, the age of the patient, and the type of cancer, because the treatment of prostate cancer is very complex, and it's multimodal. So you can have, let's say, a young man who has a tiny, nearly benign prostate cancer. So prostate cancer varies from something which is extremely dangerous to something which is nearly benign, that is not malignant. So the trend today is to classify the patient, and one can, let's say, advise regarding the risk of death, basically. And the treatment can be postponed. So at least, because we are talking about the quality of the life of that man.
Of course.
So we do not want to over-treat. So there are certain cancers which are still at the beginning in young males that one can do what is called as active surveillance. So you survey them, if need be, you do another biopsy in a year, do MRIs, and treat if there is any signs of progression. It might seem dangerous, but it happens. Because the sexual side effects related with prostate cancer are significant. And sexual side effects, we're talking about all the plethora. So sexual dysfunction, which means erectile dysfunction, libido, the want to go to... The treatment of prostate cancer basically causes an andropause, which is the menopause of men.
Okay. It's the same. Okay. It's the same with women, so and the treatment of cancer as well. The same effect.
So Here we're talking about two different cancers. One which is more in the younger age group, which rarely, well, not commonly affects sexual function, which is the testicle. Once you remove it, usually he's cured,
He's
he's
back
out,
to normal.
he doesn't need any chemotherapy, and if the other testicle is fine, both psychologically and sexually they will cope.
Yeah.
Obviously, it can affect him anything can affect you psychologically, you know, let alone removing a testicle. And prostate cancer, which although happens in the
Later stages.
well, I mean,
Usually.
50s. 50s are still young,
Yes,
you know.
of course.
And it affects them directly. And then we'll be talking about whether it is the erection which is the problem or the libido which is the problem, because you can have a good erection without libido, or vice versa. And the
You
treatment
can
is
have a good erection without libido.
of course, because the sexual function of man is there are various types of. First of all, there's the libido, which is the want.
The want.
And that is
I
related.
thought without the want you wouldn't have the function.
Yes, definitely. In fact, there is the physiological erection of nighttime. So males do have
Yes,
erection
of
at
course,
nighttime.
of course.
And that has nothing to do
Nothing
with
to
wanting
do.
to pee.
Right, okay, I understand.
And that has nothing to do with something erotic happening. So basically that happens, that is physiological. The body needs the blood supply to
It's a very
sustain
vast topic that I think we can go on talking about
Definitely.
forever.
Sexual function is fivefold, and we can talk about it later perhaps. It's the libido, it's the erection, ejaculation, orgasm. So these are all
But we're going to have another program which we're going to then just talk about that, so that would be good. But the last cancer so is penile cancer, and life after that? What happens in
It
that
depends
case?
on the stage.
Okay.
Because unfortunately penile cancer means that you have to remove the cancer.
Like
So
all others.
basically, if it is on the head and it's small, the head can be removed, and at least one could have
Carry on.
a part of the shaft. But obviously, the sensitivity of the shape and the
going to
osmosis
change.
of the penis will be changed significantly. If it's extensive, the whole penis might
Has to
need to
go.
be removed, and
And really there's nothing then for that.
the urination will be like women, basically. So basically there will be an orifice behind the scrotum. And it's a major surgery, and
is
it's
major.
rare, but obviously it is
Something that has
quite
to be dealt
mutilating. Eh?
Thank you very much, Mr.
You're welcome.
Mercia, for all of the information. I hope that you have found this to be of interest and educational to you. Please, if you have any of these symptoms, or if you have boys living in the house, if it's females who are watching and listening, boys in the house, or your husbands or your fathers, and you can try to bring up the conversation so that it's not so much of a taboo subject. You know, we really need to help men to get past this idea of these issues being taboo. So they're self-checking, going to the doctor to be checked, and if there's anything which isn't normal or looking, right, that they go and get it seen to. It's always much better to deal with these problems at the very beginning than being shy about it and leaving it to a point where then it's just too late to do anything about it. Because no matter what happens, it's always better that you're alive, even though you mightn't be 100%, but you're still alive for your loved ones and for yourself and enjoying your life. Thank you very much for watching. I hope that you've enjoyed it and found it informative. Please do refer to NIU YU Facebook page if you'd like any more information on today's subjects. And in the meantime, I wish you a pleasant evening, and we'll see you again next week.
She likes
glamour, runway, style, fame.
She likes fashion. She likes
Boys, parties, style, fame.